Hi, everyone. This is Caroline from Fiat Integrative Health in Franklin, Tennessee, and you're listening to the Fiat Health Podcast. We believe that now more than ever, the healthcare industry has become a place of confusion. And over the years, we have been asked countless questions about what true health and integration for the whole person looks like. Join us every other week as we explore topics ranging from primary care and women's health to counseling and spiritual health. We're so glad you're here. Hey, everybody. Welcome back to the Fiat Health Podcast. My name is Caroline Hartley, and I'm a family nurse practitioner and owner of Fiat Integrative Health. And today I am joined by Ashlynn.
Hi.
Ashlynn, why don't you give us just a little introduction about yourself, kind of why you got into medicine, and then we're going to jump into our topic today, which is all about viral infections.
Sure. So my name is Ashlynn. Like Caroline said, I'm a family nurse practitioner. I've been at Fiat since October, and I see whole families. So I see newborns, siblings, parents, grandparents, and that's been really special for me. Mm-hmm. My background is in critical care nursing, but I knew that there was more for me than being at the bedside. Mm-hmm. Because I really just value patient interaction and forming lasting relationships. So that's ultimately why I decided to become a nurse practitioner. And I just really value empowering families to make decisions for their health and the health of their children, and just educating them to make informed decisions for them and their families. So it's been really special.
I love that. And maybe just a little bit about why you like our more integrative, holistic model of care as opposed to just going and being, a primary care at any practice.
Sure. So I think I quickly learned in the world of medicine that wasn't all it was chalked up to be, especially when it comes to, the education piece. And I really knew that there wasn't going to be an opportunity in a typical healthcare setting for me to really empower families the way that I truly believed that the Lord was calling me to. So here at Fiat, I have the opportunity to not only empower the health of families, but their spiritual well-being, their mental health, just a holistic approach to their health versus just a quick in and out. Yeah, your height and weight are fine. Here are your percentiles. Let's move on, and just being able to go a little bit deeper in lifestyle choices and how it truly affects the well-being of their families.
Absolutely.
Yeah.
I love that. Yeah. Okay, great. Well, we're going to jump into our topic today, which we're very excited to chat about and have this podcast out as a resource for our patients and for whoever else wants to listen. So we are going to talk about a typical viral infection. So the common cold, essentially, upper respiratory infection. So just quickly, or not so quickly, if you want to run us through, Ashlynn, like, what do I expect? I'm feeling real crummy today. Mm-hmm. What should I expect of how this is going to look? And then when is it at a point where it's like, well, maybe this is out of the norm and I should seek help?
Sure. So timely conversation, as we've been seeing a lot of viral illness in the clinic.
So much.
I know. But, your average viral infection will last anywhere from 10 to 14 days. Mm-hmm. And a cough can persist for even 2 weeks after that. So.
Yeah. And sometimes I even say like a post-viral cough could last like 4 to 6 weeks. Yeah. Even just like that kind of naggy cough. Mm-hmm. It's not necessarily out of the norm.
No.
You know?
And, those typical symptoms, congestion, snotty nose, runny nose, cough, all of those things can be troublesome, but not necessarily worrisome, right? Mm-hmm. Green, yellow snot doesn't necessarily mean an infection. It's kind of a myth out there. So don't be alarmed if you or your child has green snot. Mm-hmm. It just means that your immune system's doing what it's supposed to be doing.
Right.
When is it an infection? So usually we say 10 or more days of persistent illness with colored drainage, new fever after 7 to 10 days of illness, or, for your children, change in appetite, mood, they're not playing as much, difficulty sleeping, things like that.
After the 10 days.
After the 10 days.
Right. So I feel like it's really typical. And we did another podcast all on fevers. So that's kind of its own. We're not talking specifically about fevers. We're more talking about those runny nose, congestion, cough symptoms in terms of how long it's supposed to last and all that. So I'd say very typical in children. What I see is, you've got that fever at the onset for maybe 24, 48 hours. If it's something like the flu, more like 4 or 5 days of a fever. But after that fever, you still got that runny nose and cough. And that's really what persists for that, 10 to 14 days. Typically a cough, and I'd say just like how crummy you feel in general, will peak around day 4 to 5. I feel like in adults, it's a little bit longer and later in my opinion.
Yeah, usually.
Yeah. But for kids, it's like that 4th or 5th day, you're usually in the thick of it or hopefully turning a corner and starting to improve. It doesn't mean you're better on the 6th day. It's just that we're not getting worse now. We're moving in the direction of getting better.
And, we kind of wanted to go over alarm signs or when you should seek help, right? First thing, ear infection. Kids are more susceptible to ear infections because their anatomy doesn't allow for drainage like ours does as adults.
Right.
So signs of ear infection can include a fever over 101.5, pain that's not relieved by Tylenol or ibuprofen, and sleep disruption typically are the big ones.
Yeah. And I'd say going for really anything moving from viral to bacterial is really what we're talking about, right? Like you start off with that viral illness for that initial, 5-6 days, 7 to 10 days. And it's really a typical ear infection or pneumonia sometimes will then show itself later. So just like you were saying earlier, it's concerning if you had a fever, you started getting better, fever's gone for a couple days, and then all of a sudden the fever's back. That's a sign that maybe we've got a bacterial infection now instead of a viral infection. And that's something that we would definitely want to see in the clinic.
And every time we see a sick kid in the clinic, we talk about warning signs, when to seek emergency care.
Yeah.
Right. So signs of respiratory distress. So for kids, they breathe a little faster than adults typically, but you want to count how many times they're breathing in a 60-second or a minute length of time. So average, is around 30 to 50 breaths per minute. It kind of varies with age. Babies breathe a little faster at rest than a toddler or even an adult. But if they're breathing faster than 50 to 60 times per minute, and they're using their accessory muscles, meaning you can see they're tugging below their rib cage or in between their ribs every time they take breaths. Their little nose, they have nasal flaring with every breath, and grunting, different grunting than your typical newborn grunts.
Right.
But, grunting clearly difficult to take breaths.
Yeah. Yeah. I'd say this is where it really is so beneficial to have a primary care that you have an established relationship with, because, it's the middle of the night,
right?
Or during the day, and you come into the clinic, there's countless kids that have come in that we end up sending to the ER maybe, or giving reassurance, right? Or that middle of the night call of, okay, well, how many breaths per minute are they doing? Count it. And are they tugging? And being able to walk parents through that scary moment of assessing a child in respiratory distress and give them guidance. So all that to say, like, these are general guidelines, but really when you're in that kind of a situation, you really do want somebody who you can call. And I always tell parents too, especially if it's kind of gray, it's on the line, like, with respiratory stuff, it's and especially in young children, it's much better to be safe than sorry. Like if you are wondering in your head, you're looking at your child at 2 a.m. and you're like, gosh, they seem to be struggling. Should I take him to the ER? The answer is very likely yes.
Trust your gut.
Yes, exactly. I even, my daughter, our oldest, I was a nurse at the time when she was 2, got croup. And I'm like sitting there counting our respirations at 1 a.m, not really knowing, because my nursing career was with adults. And so I felt very much out of my element and was not a nurse practitioner at the time. Yeah. Just like Googling, like respiratory rate, all the things.
Yeah.
And finally it was like, did a hot steamy shower or whatever. It wasn't helping. And finally decided to take her in. And that was like, obviously like the scariest drive ever. Sure. You got like a child in the backseat in respiratory distress, essentially.
Yeah.
So anyways, I just sympathize with anybody who's ever in that situation. It's very difficult to try to assess that with any child.
Yeah.
Okay. Let's get into symptom management, I think, right?
Yeah. Great.
Or maybe one more thing I do want to say actually for sinus infections, because I do hear this a lot with adults and I'm sure you do too. Especially my dear husband. You know, a cold comes on, it's like day 3 and he's like, I think I have a sinus infection, you know? I'm so congested. So guidelines say, what do they say?
10 days.
10 days.
Yeah.
I feel like I am even more, I don't know if liberal is the right word, but I'm more like 14 days.
Sure.
I feel like we got to wait a little bit unless you fever, clear signs of sinus infection. Maybe one day we'll do a whole podcast on sinus infections, but I just want to put that caveat out there that like, you don't have a sinus infection. Oh, you do, maybe a viral one, you know?
Right. It's not yet bacterial. I'm sure you're miserable. Yes. I'm 100%. Sure you are. We've all been there.
Yes.
But 3 days into congestion does not equal sinus infection.
Exactly.
Yeah. A viral infection has to have time to brew and turn into a bacterial infection. And we can only treat bacterial infections with antibiotics.
Exactly. So symptom relief is all around, you know, symptom relief. You know, you're not treating an actual infection. And there's all kinds of studies they've done where they, you know, shove things up people's noses and in their sinuses to test what's growing. And it was like 80% of the time, 90% of the time, it's viral. Yeah. And so treating it with an antibiotic does nothing but ruin your gut microbiome, essentially.
Yeah, exactly. Yeah.
Okay, great. Now we'll jump into symptom management. Again, for the common cold, congestion, cough. What do you suggest? What do we suggest to our patients whenever, you know, maybe they've come into the clinic and you're like, yep, it's viral. Keep riding it out, you know, doing these things at home. What do we like to do?
Sure. And, you know, this can apply to babies, toddlers, you know, kids, adults, all of these things. So, you know, first we want to promote movement, you know, drainage, move that mucus, whether it's in your chest, in your head. A couple ways we can do that is, you know, simply a hot, steamy bathroom, right? Turn the shower on really hot. Don't get in it. Don't get in the hot shower. Just let your bathroom steam up. Inhaling that moist air is really going to be beneficial to soothing your airways and help you kind of move things along. Same thing with a humidifier, right? Just make sure that humidifier in your room is really clean. You're looking inside all the parts and pieces. Make sure there's no mold hidden in there because that can happen with humidifiers.
Yeah.
If you have a nebulizer at home, you can buy one on Amazon or, you know, your provider can write you a prescription for a nebulizer machine. Just nebulized saline can really be helpful, especially with little kids. Just hold that mask up to their face and let them breathe in that humidified saline can help soothe their airways and promote a cough. You know, we want them to be coughing, get all of that mucus up. So using your, you know, some back percussion, especially on little kids who, you know, they can't clear their throat or, you know, cough things up like we can as adults. So, you know, giving them some gentle cupped hand back percussion, just help them move things along because we want to get all of that junk out of their lungs to prevent, you know, potential bacterial infection, right, from forming in their lungs.
Yeah, absolutely. I think next thing that I like to suggest is the nasal saline drops in section. And so, yeah, there's been an interesting study that recently came out of Austria that their conclusion was basically if you use saline nasal drops, so not a full-on rinse, just the drops even, it can reduce the length of the common cold by even 2 days and maybe even reduce the transmission because you're essentially kind of rinsing out those nasal passages a little bit. So definitely saline spray in section, especially for those little babies who can't blow their nose and toddlers.
Yeah.
And they hate it, obviously.
But you got to get it out. Just get it all out.
Yeah. And I will say with babies, you know, there can't be too much of a good thing. I try and avoid too much saline in section in the sense of like no more than like 4 or 5 times in a day because sometimes you're just really irritating the nasal passages. And as a response, they're like, oh, I'm just going to be more inflamed because I'm constantly being messing
with them. Yeah.
So not too much, but definitely before nursing, if they're really congested, before bed. You know, an ideal situation is you've been in the steamy shower for 15 minutes and then you're able to that's kind of thinned the secretions a little bit, and it's much easier to section out. But definitely with kids, that's really helpful.
Yeah. And if you can convince yourself to also do some nasal rinses, in adults, it's a little easier to, do it to yourself, right? With the neti pot or, like the bottle, the squeeze bottle. I find that a little easier.
The Navage too.
Yeah.
That thing is intense.
Yeah, the machine. Yeah. Yeah, that one's a little scary.
There's some really funny YouTube videos out there. People using that.
Yes,
but some people love it. So.
Yeah, some people love it. And, some people who their kids have gotten used to it, love it. Their kids are like, Mommy, please, can you rinse my nose, right? So you can use a bottle, saline rinse bottle on your kids.
Absolutely. I do it on my own kids.
Yeah.
We have a syringe version for the babies. And they do get used to it. Yeah. And also it's just so effective in clearing out that thick green mucus.
And satisfying when you see those globs of green snot.
Exactly. And I always tell parents if they're trying for the first time, I'm like, there's YouTube videos of people doing this with their kids.
Yeah.
If you have a kid, I'm like, show your child someone on YouTube doing it.
Right.
Another kid. Be like, oh, this is awesome. It's all about how you frame it. If you're like, let's do a nasal rinse, you know?
Right.
They're like, absolutely not. Yeah. You're scared and I'm scared.
Yeah. Yeah.
But if you frame it as like, this is the coolest thing ever.
Right.
You're going to blow snot
just
out of your nose.
See what comes out.
Yeah.
Like you will. Yeah.
And usually some kids will still be like, okay, let's do it. Yeah. Just, YouTube it, Instagram it. There's some really helpful videos out there of absolutely
how to hold them and, what to do for that.
Yeah. I'll say a couple other little things that I keep in my back pocket for patients and myself. I love xylitol nasal spray. So the brand name is Xlear. That's how I say it. Xlear. And the active ingredient there's xylitol. And xylitol has been shown to be antiviral, antibacterial. It's just like a step above saline. Like it's available over the counter. I've found that people who, if you're in that position where you're like, I can't breathe through my nose, but there's not actually snot coming out of my nose, it's just inflamed, then that will a lot of times just open you up enough that like you can get a good night's rest or something. And they even make it those little xylitol and saline packets that you can use to do like a full-on nasal rinse with not just saline. So that's something else I really like to utilize. And then Herbal Steams.
Yes.
Yeah. So like, you can Google this, how do I do an herbal steam? And there's all kinds of lists out there of like, these are the best herbs, especially with that cough. So like echinacea, I just say whatever you got on hand is probably beneficial.
Throw it in there.
Like thyme is especially beneficial with coughs. Basil's great, but you just throw those herbs, whether they're dried or, from your garden, into a boiling pot of water. If your kid's old enough or it's for you, try and make a tent over that pot once it's off the stove and not around open fire, using common sense. Or you can put that in the bathroom with a kid when you're doing a steamy shower, try and get some of those herbs to help you out as well. And some really fascinating studies out there that anyone can dive into about herbs and coughs and things. But I love herbal steams for congestion and cough too.
Yeah, they're great.
Okay. What are some things, I think out there in social media world and everywhere else, it's like, do this, buy this. So if I'm miserable or my child's miserable and I'm at the store and I'm looking at all of these 5 million supplements I could buy, options, what is it that I should consider buying and why?
Well, they make all kinds of, clever marketing, like this will help your cough and cold. Some non-medicated cough syrups, right, can be helpful. But something that's really helpful for cough and usually easy to get down in little kids is just raw honey. Local is better, helps their immune system, but it just helps support immune function, first of all, but it coats the throat. So it, prevents that, especially nighttime coughing. When kids lay down, they get really irritated with that postnasal drip. Just start cough. Raw honey can really help relieve that, scratchy throat, irritated airways, things like that.
Absolutely. Yeah. And I'd say if I were to have one single thing in my medicine cabinet, it's raw honey.
Oh, totally.
Because it's great for burns.
Everything. Wounds,
wounds. Like it's
acne.
cough.
You name it.
Yeah. So like a good source of raw local honey is priceless.
Yeah,
I think. But
definitely.
Yeah, that's a great first one.
Definitely. There's a couple antioxidant, anti-inflammatory ingredients that we like to use. So the first ingredient is quercetin. It's an antioxidant that has significant anti-inflammatory properties. It's been studied for its potential in affecting bacterial cell walls and managing viral infections by affecting and preventing the viral replication in your body. Bromelain and N-acetylcysteine are also wonderful ingredients. They're both powerful anti-mucolytics. So think like a natural version of Mucinex.
Right.
Bromelain is interesting because it's extracted from a pineapple.
Yeah.
So little kids, just feed them pineapple.
Yeah. Pineapple juice.
Yeah.
Pineapple in general.
Yeah.
Yeah. I love telling parents that.
I know. It's
then
great.
The secretions. What typically, you're going to hear in acetylcholine as NAC.
Yes.
So NAC is what you'll see over the counter for that.
Yep. So both are great ingredients, and usually you can find like a combo. There's a lot of supplements out there that have all three ingredients in it. They usually are named something like sinus support or, Sinuplex, something like that.
Yeah. I think DHIST and DHIST Junior both have all three of those ingredients as well. And I think just a funny story to go with the pineapple is a couple years ago when I was first practicing, I, told somebody, oh yeah, like pineapple juice can help thin the secretions. And I came back like a month later. It was for their baby, like maybe a 9-month-old. Came back like a month later and they're like, she's still sick. And, I was like, yeah, it looks like she's lost some weight. Like, yeah, we replaced one of her bottles with pineapple juice. And I was like, oh no. That's definitely not what I meant.
Yeah.
I said you should use some pineapple to help thin the secretion. Just, word to the wise.
Right.
Like,
fair. Just to clarify.
All in moderation.
Right. Yeah.
Yeah.
That's funny.
Let's replace that back with the nutrients that they need, in milk or formula or whatever, breast milk. Anyways, tell me about high dose vitamin C, because I think this is a great tool.
Yeah. High dose vitamin C, it's something that we here at Fiat have been looking into more and started to use a lot more. So there's we know there's lots of evidence and data on what vitamin C does to the body, right? It fights free radicals, helps support the function of immune cells, reduces inflammation, etc. But, in the context of illness, high doses of vitamin C have been beneficial to decrease viral load and really just eliminate those free radicals that illness is causing. So when we say high dose, first of all, it has to be a specific kind of vitamin C because you're taking it in such high doses. It has to be sodium ascorbate. Any other version of vitamin C is too acidic, so it will upset your stomach. You can't really overdose on vitamin C. Your gut will tell you if you've taken too much. Right. You'll get uncomfortable diarrhea, usually only once, and you'll know, okay, let's decrease the dose this time. But we've had parents come back and say, yeah, I put my kid on high dose vitamin C for a week. They got better. As soon as I stopped the vitamin C, their cough came back. Put them back on it and their cough went away. So there's interesting paper on the effect that vitamin C has on the cilia of the lungs, the lining of the lungs. And that's why it helps prevent cough or treat cough so significantly. It's very interesting.
Yeah. Yeah. It's really fascinating. And I think too, with the sodium ascorbate, looking for like a liposomal is also nice in the way that it's absorbed well.
Or
and I'd say, this is one of those things that it is good to have a good relationship, because there are other factors you think of in terms of kidneys and, maybe it's definitely not the right to go such a high dose for everybody. In general, it's really fine, but it's good to have that recommendation from your own provider. And
and even just to help you, kilograms are hard, right? So trying to figure out that dosing,
But for sure, your body will tell you that you've had too much, because you will have loose stool.
You will.
And you say, okay, take it back down, take half dose.
Yep.
from what I did yesterday and then see how it goes.
Yeah.
I'd say next is echinacea. Tell me why you like echinacea.
So echinacea has some pretty significant antiviral properties. Some people take it daily, through tea or a tincture just to, prevent any sickness. But it can inhibit viral replication. So in, slightly higher doses during high risk seasons, like, fall through early spring, can help prevent. And then for acute symptoms, you can essentially double the dose that you're taking for a couple days. And it can help inhibit that viral
replication. Yeah, for sure.
And the tea version's great too, because it will help soothe your cough, soothe your throat, things like that.
Absolutely. Yeah. Another one we like, and I think a lot of our patients like, is having elderberry on hand.
Yeah.
Elderberry has a lot of great studies on it as well for its kind of immune boosting. It's an antioxidant, similar to Kirsten. A lot of people like to make their own even.
Yeah.
But you can buy it.
Yeah. There's a lot of great
stores
in Middle Tennessee that make it.
I feel like kids like it when you mix it with honey.
Yeah.
They'll take it. I think there's been especially studies related to flu and elderberry. So that's definitely one where it's like, okay, we're dealing with the flu. It's great to get elderberry on board. Some evidence with cough, but not as strong. Definitely won't hurt by any means.
Yeah.
But anything else you can think of?
Just having a well-rounded, clean diet, especially in seasons of illness, right? Really trying to limit, processed sugars, processed foods, all of those can really have an effect on your health and, even more of an effect when you're ill.
Yeah. I think it's so ironic that like Thanksgiving and Christmas and New Year and all of that falls like smack in the middle of sick season and your kids have 5 million parties.
All the sugar.
So much sugar.
Yeah. Yeah. Whole foods. Bone broth is wonderful when you're ill. Can really support the gut and your immune health.
100%. I call it, in our house, we call it tea because you just put honey in it and say it's tea time and they'll drink it. They love it.
That's great. I love it. Yeah.
I will also give a little caveat. I feel like just for anybody out there who's like, oh my gosh, this is so much stuff.
How will I ever get my kid to take all this?
Yeah, exactly. I personally am a total minimalist when it comes to these kinds of things. If you looked in my medicine cabinet right now, you would find raw honey.
And bone broth.
And bone broth.
Yeah.
And, maybe if we deal with a sore throat, I'll buy throat coat or, some other little things. But like 2 of my kids currently have the flu and I have not given them any of this.
Yeah.
And their fever's gone in 48 hours. You let it run its course. So, if you're like me and it's like, we're going to grin and bear it. And I'm not going to try necessarily to use all of these things.
Yeah.
Then that's totally fine.
Totally. Or you can be like me and chase my husband around the house with all of my tinctures and sprays. And he's like, those taste horrible. I'm like, no. They'll make you feel better.
Oh, I love it. Yes, exactly. And there's absolutely nothing wrong with that.
Right.
And I love having these things in my back pocket.
Yeah.
Or when, okay, maybe there's a point. I call it your misery meter.
Yeah.
Your misery meter will drive how many supplements you're willing to buy and take.
Right. Totally.
And give your children and all the things. So everybody has their own way about it, but it's great.
Yeah.
Just knowledge to have that, like, if you're really suffering, there are things you can do that aren't just running to a walk-in clinic and asking for an antibiotic, which they will likely give you, or doing nothing. If you're like, I really want to try and do something, then these are really great tools to have. Okay. Last thing we want to touch on real quick is basically just the idea that getting sick is not a bad thing. I think it's common, especially in kind of the health community, to be like, oh my gosh, well, I'm taking these vitamins and supplements. I've got a good diet. I'm getting good rest. Like, how could I possibly be sick? Which is just not quite the right mindset when it comes to how our bodies work. Our bodies were made to fight off illness, to get sick, unfortunately. Maybe we can thank the fall of Adam and Eve for that, but it's the reality of where we are. And so I just want people to really take away that getting sick is not a bad thing. It's your body doing what it's supposed to do.
Exactly.
There are various studies and things that have looked at kids who are in preschool age, so that 2, 3, 4 range, get an average of 2 illnesses a month.
Yeah.
Which is basically means you're sick all the time.
Whole month.
Back to back. Yeah.
Yeah.
So, if your kids are in that age range and you're like, my kid is literally always sick, it can be normal to have that cold. What you want to see is that they're fighting it off. So they get sick, for that couple of days. They've got the runny nose, the cough, maybe a fever, maybe not. And then they start to get better. And then same for school age, an average illness is once a month. And so again, try and keep that in mind if your kids are coming home with runny noses constantly. Now, there is certainly times that that kids can be sick too often. And again, this is where having a primary care can be really helpful. Like I recently worked with a sweet young girl, school age, who was getting high fevers recurrent. She would just seem to get every illness that went through the house. She got it, and she got it much worse than anybody else. Her siblings are recovering in that normal 5 to 7 day range, and she is just out with a high fever. We ran some blood work, we did some stool tests, and saw your immune function, your immune system really isn't responding well when it meets these illnesses, and it doesn't seem to have the tools to be able to do that. And so we did some great gut work, foundational things, and she did much better.
Great.
Handling illness as well.
Yeah.
And so on one end, it's yes, it's normal to be sick very often, but there is a point where you're like, this is too much.
Right.
Maybe there's something bigger. We need to dig deeper and kind of look at, again, running some more tests or doing some more work with your gut. And I think too, there's I really love this hygiene hypothesis is what it's called.
Yeah.
I ascribe to it.
Yeah.
Especially I came from a big family. I have 6 kids. So I feel like anecdotally, I've seen it work. Yeah. And the idea is basically that children who aren't exposed to enough germs have essentially less of an immune system. And they have a hard time, their immune system has a hard time differentiating between harmful bacteria or harmful substances and harmless. And a lot of people think that this, and I would agree, that this plays a role in the rise in chronic disease.
Yeah.
Asthma, allergies. There's a whole argument in terms of I don't think this is the only thing, but I think it plays a big role in it. And I think we also don't realize that our generation grew up probably a lot of times in a more sterile environment, unless you were on a farm or in a big family. And so you're passing your immune system onto your baby because you think, why is my, for instance, this young girl we worked with, she's so young. How could her immune system not have what it needs? And part of it is that we've passed this down. If I wasn't exposed as a child to these different things and built a robust immune system, then my children are going to start off with less of an immune system,
right,
and be more vulnerable. So I'm all for sharing drinks.
Yeah.
And I know that would totally gross some people out, but in my house growing up, it was nothing was your own.
Right.
Right. You actually didn't have a cup.
Right. Not to say, don't seek out illness. Yes. Right. I think my parents' generation is let's go have a play date with them because they have chicken pox. Right. That's not what we're saying.
Yeah. You can do that if you want.
Yeah.
But
yeah.
That's its own conversation.
Yeah, definitely. But, it just overall, your immune system learns. So every time you get sick, the next time you're exposed to that pathogen, your body's like, oh, I know this and I know what to do.
Yep.
So it develops a more efficient immune system over time too.
Right. Oh, exactly. Exactly. Don't be afraid of illness.
Right.
Don't think something's wrong because you're getting sick.
Right.
But also, yes, probably don't necessarily have to seek out all the illnesses.
Yeah.
Yeah. I think the whole washing hands theory goes into this of sterile environment. We've become so sterile and we're not exposed to things where maybe it's not such a bad thing to get sick and be exposed to different bacteria and germs and things to help our gut, our immune system really be robust is what we want.
Exactly. The Lord created us with pretty amazing regenerative, systems like our immune system and our gut microbiome. And, it's our job to keep those things healthy. Right.
Absolutely. And it's like, along with the good diet and lifestyle and, maybe supplements and things, like illness is a part of that.
Right. Right.
And it's not something to be afraid of.
Yeah, exactly.
Okay. Awesome. Well, this has been so fun.
Yeah.
I hope it's been beneficial.
I think it has been.
Yeah. To everyone who hopefully listened to it and use it. If you would like to find out more, you can check out our website, fiathealth.org. We do some social media posts, not a lot, but you can follow us on Instagram.
Yeah.
And we hope to see you. Well, not see you. Be back with you next time.
Thanks, Caroline.
Great talking with you, Ashlynn. Thanks for listening to this week's episode. To learn more, you can visit our website at fiathealth.org. If you enjoyed this episode and you'd like to help support the podcast, please subscribe to our show on your favorite podcast platform and leave us a review. This helps make the podcast easier to find. Lastly, if you'd like to reach out, ask a question, or suggest a topic for a future show, send us an email at media@fiathealth.org. God bless.